All right, future nurses, let's talk about it. Let's tackle one of the most feared topics for the NCLEX, lab values. I know, the sheer number of them can feel totally intimidating, but we're about to break down the absolute essentials you need to know so you can walk into that exam feeling confident.
I mean, does looking at a giant list of lab ranges just make your head spin? If you've ever felt completely overwhelmed trying to memorize every single decimal point, trust me, you are not alone. It is one of the biggest anxieties for nursing students everywhere.
But here's the good news. While you can't really avoid lab values on the NCLEX, you can absolutely 100% master them. So in this explainer, we're going to filter out all the noise and just focus on those high-yield numbers that are most likely to show up. Let's do this. Okay, first up, the absolute foundation of lab work, the complete blood count, or CBC. I want you to think of it as a story being told by all the tiny cells working 24/7 to keep your patient alive. So, the CBC is one of the most common lab tests you'll ever see. It gives us this incredible snapshot of 3 key players in the blood: your red blood cells, which carry oxygen, your white blood cells, which fight infection, and your platelets, which help you clot. It's a true powerhouse of information. Let's look at the core numbers. White blood cells, or WBCs, should be hanging out between 5,000 and 10,000. If that number drops too low, that's called leukopenia, and it could mean your patient's immune system is compromised. Then you have platelets, which are essential for clotting. The normal range is 150,000 to 400,000. If they drop way down, a condition called thrombocytopenia, your patient is at a huge risk for bleeding. Next up, hemoglobin and hematocrit. These guys tell us all about the oxygen-carrying capacity of those red blood cells. And you gotta notice the different ranges for males and females here. For females, hemoglobin is usually around 12 to 16, while for males, it's a bit higher at 14 to 18. Remembering these differences is really important for an accurate assessment. All right, we've talked cells. Now let's shift gears from blood cells over to blood chemistry with metabolic panels. Whether it's a basic one, the BMP, or a comprehensive one, the CMP, these tests give us a vital snapshot of a patient's internal chemical balance. So, a metabolic panel is checking out a patient's electrolytes, their kidney function, and their blood sugar. The more comprehensive version, the CMP, adds liver function tests into the mix. Seriously, think of this as ground zero for figuring out your patient's overall metabolic state. Okay. Let's look at these key electrolytes. I want you to notice a pattern here. A lot of these ranges involve the number 5, right? Potassium is 3.5 to 5.0, calcium 8.5 to 10.5, and a normal glucose is 70 to 100. Using 5 as a kind of mental anchor can be a fantastic memory trick for this panel. Now let's talk organ function. For the kidneys, we're monitoring BUN and creatinine. That creatinine level, 0.6 to 1.2, is a really critical value to remember, because if it's elevated, it can point to kidney damage. And for the liver, high levels of ALT and AST can signal injury. An elevated bilirubin? Well, that can lead to jaundice, which is that yellowing of the skin and eyes. Okay, we have covered the basics. We've got our foundation. Now let's dive into some of the more specialized, but still very, very common lab tests that you're going to see on the NCLEX and for sure in your clinical practice. Coagulation studies, or coags, as you'll hear them called, they measure how long it takes for blood to clot. And listen, for any patient on a blood thinner like warfarin or heparin, this is just non-negotiable knowledge. These tests tell us if the medicine is working or if the patient is at risk for either clotting or bleeding. Okay, this is a super key distinction. There's a normal range and then there's a therapeutic range. They are not the same thing. For a patient on warfarin, we're actually aiming for a higher INR, usually between 2 and 3. And for a patient on heparin, we monitor the APTT. We're looking for a therapeutic range of about 60 to 80 seconds, which is about 1.5 to 2.5 times the normal value. All right, you ready for a super simple way to remember your lipids? You'll never forget this. For LDL, that's low-density lipoprotein, just think L for lousy. You want that lousy number to be low. For HDL, high-density lipoprotein, think H for happy. You want that happy number to be high. It's a silly little trick, but it absolutely works. So, applying that little mnemonic, here are the target values we're shooting for. We want the total cholesterol under 200 and triglycerides under 150. And then our lousy LDL should be under 100, and our happy HDL needs to be above 60. See? Easy.
arterial blood gases, or ABGs. Now, this topic could be its own entire deep dive, but for now, let's just lock in these three core values. A normal pH is between 7.35 and 7.45. PCO2, which is our respiratory indicator, should be between 35 and 45. And bicarb, our metabolic indicator, should be between 22 and 26. So the hemoglobin A1C isn't a snapshot of blood sugar right this second. It's more like a highlight reel of the last 3 months. For someone who doesn't have diabetes, the target is 4 to 6%. For a patient who does have diabetes, the big goal is to keep that A1C below 7%. And finally, let's just touch on a few common therapeutic drug levels. For medications like digoxin, lithium, and dilantin, the really big takeaway is that they have a very narrow therapeutic window. That means the difference between a helpful dose and a toxic dose is super small, which is exactly why we have to monitor them so closely. Okay, wow, we have covered a lot of numbers. So the big question is, how do you apply all this knowledge to actually pass the NCLEX? Let's talk strategy. This right here, this is the most important takeaway for the NCLEX. You do not need to panic over a potassium level that's just a tiny bit off. The exam is going to test you on values that are noticeably abnormal. They want to see if you can spot a critical value that requires you to do something right away. So here is your game plan. First, master your CBC and your metabolic panels. They're your foundation. Second, commit those core ranges we've talked about to memory. And third, on exam day, look for the value that is clearly significantly out of range. Trust your knowledge, you've got this. And we're going to end with this thought. Memorizing lab values, that's just the first step. The true skill of a great nurse is in answering the next question. What does this number mean for my patient? And what action do I need to take right now? That's the critical thinking that will define your entire career.